Guys, I'm Johannes de Guzman.
I'm Chester Patawaran.
And I'm Dexter Gomez, and our topic is about emotional disturbance. So guys, let's start.
What is emotional disturbance? The term emotional disturbance was first used by IDEA, Individuals with Disabilities Education-Act, in the 2nd of February 2014. If a child exhibits one or more of these characteristics over a long period, this will affect a child's educational performance. A student incompetence in learning and not explainable by intellectual, sensory, or health factors. A student incompetent in building or maintaining any type of relationship with peers and teachers. Unfitting behavior or feelings on normal conditions or events. A student in general pervasive mood of happiness or depression. A student chance to develop physical symptoms or fears associated with personal or school problems. Anxiety. Based on anxiety is a response from stress. It can occur when a person has feelings of apprehension, uneasiness, uncertainty, or dread from real or perceived threat. Anxiety has different levels, increasing intensity, mild, moderate, severe, and panic, which will affect a person's ability to properly function. The observation of Harry Staff Civilian in 1947, occurrence of anxiety starts at infancy. When an infant senses displeasure, they become hard to feed, irritable, and restless. Even when the mother is displeased or stressed, the infant becomes stressed too, because there is a strong connection, and the infant senses the feeling of insecurity from her mother's love. And this feeling is what Sullivan calls as anxiety, consists of insecurities and negativity from people or people around us. Causes of anxiety. Biologic vulnerability. The disorder is somehow connected with neurotransmitters within the limbic system. Gender. Female have a higher chance than male. Other psychiatric disorder. High comorbidity rate with other psychiatric disorder, including major depression and panic disorder. Psychosocial factors is associated with low self-esteem, low tolerance for stress, and tendency to believe external locus of control. Types of anxiety. Mild, a person has increased alertness and enhanced learning. Moderate, a person can focus on main concerns but has difficulties in being attentive and being able to learn. Severe, a person lost the ability to focus and solve problems and his or her sympathetic nervous system is activated. Panic, a person cannot focus and unable to cope and fight or flight response to problems. Schizophrenia, a psychotic reaction that affects an individual's function, including thinking and communication, perceiving and interpreting reality, feeling and demonstration of emotion, and behaving in social acceptable manner.
Ikaw mo naman ang cover na. 5 pa pala, hindi ka napapasa.
Hindi, kahit parang cover niya, ang cover pa naman.
Oo, cover. Agad ang cover yun. Tinanggap mo naman natin. Tapos mo mo.
Hindi, kaya papawin mo ang gano'n ko, cover pa naman. Hindi, ayoko mamatay, hindi ko nga pa sa buhay. Wala! Wala!
Causes of schizophrenia. Genetic predisposition, a significant risk factor, and the combination of genes can result to the child to have schizophrenia. Neurodevelopment abnormalities. Minor fetal malformations during early gestation may play a role in manifestation of schizophrenia. The factors are influenza, trauma or injury and abuse or trauma. Psychosocial and environmental factors. The lack of nurturing love and attention has effect on role in manifestation of schizophrenia. Paranoid, characterized by systemized delusion and hallucination and less regressive. Disorganized speech and behavior. Other mannerism, extreme social withdrawal, neglect, appearance and hygiene. Catatonic, characterized by psychomotor disturbance. A person with catatonic stupor exhibits inactivity, negativism, and abnormal posting. Undefined, the features are delusion, hallucination, incoherent speech, and disorganized behavior. Residual, a current absence of acute symptoms. Bipolar disorder is a disorder in the brain that affects a person's mood. This person can experience extreme moods, bouncing from depression, euphoria, or might primarily exhibit symptoms of mania.
Sa inyo mga classmates! Magandang araw na to. Saan mo? Sir, good morning po. Bago na ang sabi niya, sir. Yes, sir.
Causes of bipolar disorder. Psychosocial theories, psychiatric professionals believe that bipolar is caused by psychosocial difficulties, developmental theories, family fault dynamics, responsible for manic behavior. Neurotransmitter and structural hypothesis. Caused by neurotransmitter deficiency, manic episodes also relate to excessive levels of norepinephrine, dopamine, and imbalance between cholinergic and noradrenergic system or lack of serotonin. Comorbidity. Abuse of any substance can affect the baby, sometimes resulting to bipolar. Types of bipolar disorder. Bipolar 1 disorder. A patient's experience swing between manic episodes and major depression. Bipolar 2 disorder. A main difference is between patient has never experienced a manic episode but only hypomanic episodes. Cytotimic disorder is explained as a swing between obsessive-compulsive disorder or OCD. A crucial feature of OCD are recurrent obsession or compulsion that are severe enough to be time-consuming, cause marked distress, or lead to significant impairment in one's function. The disorders often begin in childhood and adolescence. Causes of obsessive-compulsive disorder. Biologic vulnerability, increased serotonin responsiveness, striatum dysfunction theory, performing things again and again from serotonin deficiency, genetic vulnerability, the risk is higher with family history of OCD. Types of obsessive-compulsive disorder. Checking, the need to check is the compulsion, but the obsessive fear might be to prevent damage, fire, leaks, or harm. Contamination, the fear of being dirty, and contamination is the obsessionary worry. Often fear is that contamination might cause harm to oneself or a loved one. Symmetry or ordering, the need to have everything lined up symmetrically just right is the compulsion. The obsessive fear might be to ensure everything feels just right, to prevent discomfort or something to prevent harm occurring. Depression, otherwise known as major depressive disorder or clinical depression, is a frequent and serious mood disorder. People who suffer from depression experience persistent feeling of sadness and hopelessness, and losing interest in things they have fun doing in the past. Aside from the emotional problem caused by depression, individuals can also present with physical symptoms such as chronic pain or digestive issues. To be diagnosed with depression, symptoms must present for at least 2 weeks. Causes of depression. Neurochemical theories. When the level of neurotransmitter is alerted, it will result to neurochemical depression. Genetic theories. Heredity and genetics are basis for depression. Psychological theories of depression. A person who has adversity early life experiences, intrapsychic conflicts, reaction early experience have chance of depression in the future. Types of depression. Major depressive disorder. It involves psychological, biologic, and social symptoms that impairs a person's function and interaction. Dystemic disorder. When a person has a depressed mood for the last 2 years, a person is chronic. Needs of a person with emotional disturbance. academically performing below grade level, performance below grade level in reading, math, writing, and spelling. Emotional disabilities can result to learning difficulties. For example, if a student has severe anxiety, they will be unable to attend, listen, and learn while in school. May lack social skills that are necessary for communication. Having a problem expressing ideas in understanding what others are communicating. No strategies in school, such as memorization skills and attention, which may lead to academic difficulties. Hard time in organization and time management. High chance of dropping out of school, affecting their future. Some have verge or even above average academic achievement. Low attention span. Teaching strategies. Keep classroom activities simple and clear. Have few and important rules. Be on time, try your best, be polite, and respect one another. Reward positive behavior. Give prize incentives so they will strive to earn one and be awarded for being good. Allow for mini breaks. Give them few minutes so they can rest and observe the lesson. Fair treatment for all, so special treatment to any students in any shape or form is negative. Use motivational strategies. Motivate the child to do their best, not another way around.
So, yun lang yun guys. Sana may natutunan kayong maayos sa pag namin. And maraming salamat sa panonood.
Thank you sa panonood sa amin.
Peace.